Hi, it's Jason from BodyWorx Physio. So today what we're looking at doing is a stability tape for the knee for things like your medial and lateral ligaments, returning to sport after your ACL surgeries when you want a little bit of support there. So traditionally what a lot of the time people did when they were taping this is they'd get somebody to pop their heel up on a roll of tape and to keep the knee bent. I usually recommend if you can lean back against a bench or something, it's much more relaxing and you can actually just sit there and relax when you're doing this. So to start with, we want some anchors, and to do these I usually use some hypersensitive tape. If you're going on for a sport like AFL or rugby or that, I would also apply the spray-on tape adhesive underneath this, because it just means it's going to stick much better. The same thing when we're doing shoulders, just because it gets so sweaty and the joints are moving so much, you tend to find the tape's going to peel up unless you add a little bit of that adhesive underneath there. So this is just giving the rest of the tape something to stick to. You tend to find tape sticks really well to itself, but it'll tend to lift up off the skin a little bit once it's got tension on it. So putting these anchors there just gives the tape something to grab onto. So it may seem like I'm taping quite a fair way away from the joint itself, but because we've got such a long lever in the leg, we need to tape quite a way, and sometimes you'll even tape a bit further depending on how much support you want to give it. Once you've got those anchors on there, we want to do a cross. So one of those on each diagonal. Now, depending on the size of the knee determines how many strips of these you do. If you've got a small or a moderate sized knee, you might only do 2 strips in each direction. If you've got a large knee, you might do 3 or 4. So it's going to have to depend on the body weight of the person and how much force is going through that knee. If they're a big rugby guy at 90 or 100 kilos, they're going to need quite a few strips on there. So once you've done your diagonals, we can then move on to the straight strips down the inside or the outside. If you're just taping for a medial ligament, sometimes you'll see people will just do the cross on the inside and the straight strips down the inside to protect the medial ligament. I would generally favour just to do both sides if you've got time. If you push for time, just do one side, but generally speaking, I prefer to take the whole knee. And then with the strips, we start just on the inside of the knee. Placing that down through there. Try not to get any wrinkles in it. Bear in mind, if you do get any bad wrinkles in the tape or it starts to fold on itself, give up on that strip of tape. It's sometimes like glad wrap with adhesive and it's really not worth the trouble. Same thing on this side, going down the outside here. And you can see I've left a really nice pocket there for the kneecap. If you tape in too tightly on this kneecap, you're not going to be able to get much bend through the knee. Once you've done that, and you've got as many strips as you want on the diagonals and on the straights, lock your strips down. So just same thing, going over your anchors again to hold that all in place. Don't go right around in one strip. So you can see when I've been doing my anchors, I'll do one at the front, and then I'll do one at the back. The important bit of that is when those muscles tense up and you're running, if you go right around, you'll actually take too tight and you could cut off some of the circulation in there. And they won't feel very comfortable with it. So same thing across the top. So we've done that. The other thing you can then add in from that point is some of the stretching EAB if you want to overwrap it. And that's just a matter of around, just to give it an overwrap to help hold all of that down. It does depend on your club's budget and how much tape they've got and whether they've got the EAB with the rigid and everything. Yeah, once you've done that, at the end of your EAB, always use a little bit of your rigid tape to hold it down, because you'll find that bit there, as soon as it gets rubbed on, will peel straight back. So pop a bit of rigid tape down there to hold it on. And there you have it, a knee taping that will help support for medial and lateral ligaments. It's also good for ACLs returning from surgery. Always make sure you have a good rehab program before returning to sport following your ACLs. Any more questions about knee problems or pain, give us a call. Call 4952 7033 or book in online at www.bodyworxphysio.com.au.